Hello, good afternoon on Wednesday, June the 3rd. Thank you all for being here, and thank you all for wearing masks where possible. I will remind everyone, the people of our great state, that we are still in the eye of the COVID-19 storm. We've extended the time of transmission by flattening the curve. That is the good news. But it also comes with bad news. Our enemy is still here. It is as present, as contagious, and as deadly as ever. Please, to my fellow Mississippians, stay sharp. Please stay smart. Look after yourselves and look after your family. Throughout this process, I have thanked our healthcare community for the sacrifices that they have made and the incredible work that they have done, many times in dangerous circumstances. I am in the front line of the chorus praising their heroic efforts to test and treat Mississippians affected by the coronavirus. Mississippians have been tremendous. Our healthcare workers have been tremendous, and we all owe them a huge debt of gratitude. I also want to continue to remind our healthcare sector that there is still an executive order in place to ensure that 25% of capacity is available for COVID-19 patients. That must continue. That must happen. And if it does not, it will severely undercut our efforts to keep our healthcare system from being overwhelmed. We know that those procedures are important. We know that elective procedures are important, especially in financial times that has been exceptionally difficult for so many in the healthcare space. Remember, though, that you are ground zero for this fight. We need you to do your part to ensure our own systems are not overwhelmed. Remember our goal. Our goal is that every single Mississippian that can get better with quality care receives that quality care. We are committed to achieving that goal, and we will support you however we can, but we need you to help protect yourselves as well. We know that we must reserve excess capacity for COVID patients. That is not a suggestion. It is a rule. Please remember it, and let's all pay close attention to it. To the people across our state, please stay in the fight. Most of our outbreaks have not been traced back to the work environment. They have been traced to parties, to gatherings, and some even to parades. Reckless activities or ignoring executive orders, especially for our most vulnerable, do not need to happen. We can't predict the future, and while we have rules in place, it is impossible to break up every gathering. We need you as our fellow Mississippians to step up and make good decisions. Please follow the orders that are in place, and please follow the guidelines that are in place. If you do not, I will be forced to make decisions that I do not want to make. I did not want to shut down any business in our state, but I did so because it was in the best interest of the health and safety of my fellow Mississippians. I have no intention of shutting down businesses in the future. I have no intentions of having to enforce some of these guidelines on healthcare facilities, but I need you to follow the rules. I need you to follow the guidelines, and I need you to follow the executive orders. Switching gears a bit, I promised news on DMV today. Our new Commissioner of Public Safety, Sean Tyndall, will take us through the details. They will be opening back up on Monday. There will be procedures in place to help them operate safely and efficiently. Let's be honest, they were not the most efficiently run operation in the history of the world before COVID-19. The pent-up demand created by this pandemic is only going to make the existing challenges even worse. We believe that we have a plan in place to make it run as safely and smoothly as possible, but we also know that there's a lot of structural work that we've got to do for a real fix. If you can wait to deal with any issue, please do so. We're taking steps to make it far less necessary for many people to actually have to physically visit the DMV. If you need to renew or duplicate your ID, do not go to the station to do it. In fact, that's not even going to be an option. Do it online. We're extending the expiration date for concealed carry permits automatically through the rest of the year. Road tests for teenagers looking to get their license will be waived. No need to do that. If you've been responsibly using your learner's permit, you will be able to get your license. We're also going to try and organize the crowds by having specific days for different last names. Monday will be last names starting with A through E. Tuesday, last names starting F through L. Wednesday, anybody can come. Walk-in Wednesday is what we're going to call it. Thursday will be M through S, and Friday will be with those last names that begin T through Z. We believe and we hope that that will cut down on wait times. And we also hope that crowding, if we don't do this, then the crowding could contribute to spreading COVID-19. At this time, I'm going to turn it over to Commissioner Tindall, who's going to offer even more details. Commissioner, thank you for your work on this.
Thank you, Governor. As the Governor mentioned, obviously this is a big day for most Mississippians. As soon as his nomination of me was announced, I started receiving text and email, when is the Department of Driver's License Services going to be open? So in order to accommodate that and get us open in a manner in which doesn't create additional chaos and long lines and contribute to the spread of COVID, we came up with these procedures which we feel like will help move things along accordingly. First and foremost, I want to emphasize that we will be operating with strict adherence to the recommended social distancing guidelines. We have plans and procedures in place for the operations of the driver's license services bureaus and stations, as well as nightly cleaning, so that the next day when people come back, the facilities will be cleaned. To start with, I will list the services that will be available at all permanent driver's license stations. You'll be able to get your CDL transactions done there. Your out-of-state transfers will be done there. New credentials, new identification and card credentials. You will be able to get your security guard permits. That will be on Wednesday only. The reason being that it requires fingerprints and it requires an MBI agent to be present in order to facilitate the fingerprints. Sexual offender registration will be done at the driver's license stations. Learner's permits will be done there. When a student comes to get the learner's permit, they will have to take the written test at the driver's license station. We'll be doing reinstatements of driver's license. If you had a driver's license that's been suspended or it cannot be renewed because it's been more than 18 months since it expired, you will be able to get your license reinstated or reissued a new license at that time. Non-U.S. citizens that are needing driver's licenses will be able to do that at the driver's license stations. And lastly, ignition interlock restricted licenses will also be issued there. As the Governor mentioned, you will be able to renew your driver's license, get a duplicate driver's license, or an ID card, renewal of or duplicate of an ID card, and address changes online. It's imperative that if you can utilize the online services, that is what you do. If we have, that represents 80% of the foot traffic that we had at the driver's license services stations. And if we can take that out, it'll help everybody move through the process much quicker. And the great news is we've seen a lot of additional traffic, people renewing online. When you renew your license online, it's for 8 years. So theoretically, you can get it done and not have to come through the driver's license service station again for 16 years total. So we want people to utilize that. As the Governor mentioned, we will separate the days, and certain days will have the first letter of your last name is when you will need to come to the station. Once that is done, and we'll see how it spreads out, if the numbers start dropping down, we'll probably lift that. There's no timeline on that. We will have a thing called Walk-In Wednesday, which means anybody can show up on that day. Some people have jobs. They might not be able to come on Monday. They might not be able to come on Thursday. We needed a day in which anybody could show up. As the governor mentioned, we will be waiving the road test for those that are getting their driver's license. In particular, those that are under the age of 18 years old, which would normally mean that they had a learner's permit during that time, instead will supply us with an affidavit from their parent or guardian certifying that they have operated the vehicle under the supervision of their parent or guardian for at least 50 hours. And with that affidavit, you will be issued your driver's license if you're under the age of 18. And I would encourage those that have any questions or need to know what documentation they need to bring to go to the DPS website, which is www.dps.mississippi.gov, and they can go to the Driver Services Bureau link for additional details.
Thank you, Commissioner Tindall. At this time, I will turn it over to Dr. Dobbs to give us an update on our cases. Dr. Dobbs?
Yeah, thank you, Governor. Update for today, we are reporting 302 additional cases today with an additional 15 deaths. That brings our total case burden up to 16,322 with 782 total deaths. If we look at long-term care setting, we have 126 active long-term care outbreaks with 406 deaths. If we look at our deaths overall, 51.9% are African American, 43.2% are Caucasian, and if we look at the mortality rate among Native Americans, it is very high. 3.4% of all of our deaths are attributed to Native American populations. Hospitalizations, we have seen continued pressure on the healthcare system with some steady number of cases of coronavirus being hospitalized, requiring ICU use, and also mechanical ventilators. We had an increase up to 455 cases in the hospital, but paired with increased normal hospital utilization has put a real strain on our healthcare system, and we've seen in certain regional areas the lack of availability of ICU beds. So that's something that we're going to have to pay a lot of attention to, and a lot of that is driven by a combination of ongoing significant coronavirus transmission that's overburdening the health system on top of what would be the baseline activity. If we think about what needs to happen for that, the best thing that we can do is prevent community transmission. If you look at the age of individuals who are getting coronavirus now, most of them are between 18 and 29 years of age. It's people who are going out in the community who are violating the existing orders on limiting on social distancing and also too on mass gatherings. And if we look at some of the scenarios that we're encountering from the public health perspective, we're seeing more and more outbreaks associated with shrimp boils, with people going to a party. We actually had, like, as an example, an ICU nurse who'd been taking care of coronavirus for months and did not get it, was recently tested positive because she caught it in the community. And so we have this reverse scenario where people are bringing it into work because they're catching it in the community. So very important for us to be conscientious of that, follow the rules closely, and use some common sense, wear the masks, and please, the rules that are in place for businesses and also for the community are good, they're reasoned, and they follow the principles of preventing transmission that CDC has laid out very clearly. If we follow them, we'll be in so much better shape than if we don't. If we look at the long-term care situation, we still have significant number of outbreaks. We did get a recent updated Attorney General's opinion that said in the current scenario, we can release the names and information on the different nursing home outbreaks. And so we will make an effort to get that out today. In addition, we'll try to get some numbers associated with that. I will have to say that we're getting inundated with very specific data requests from different newspapers, and that's not something that we can meet all these individualized requests, but we will combine the principles of these requests and have that data in a singular format available in the near future where that can be available to all. So please look forward to that. And then the last thing is, as we get ready for back to school, in addition to prepare to prevent coronavirus, we got to get kids their shots and get kids their birth certificates. So please go ahead and go online and order your birth certificate if you need it. And if your kids are behind on the shots or getting ready to start or going into 7th grade, call your pediatrician, call your family doc, or call the health department and get an appointment. We'd be very happy to make sure that all the kids are up to date in their normal shots. Thank you very much, Governor.
Thank you, Dr. Dobbs, for your effort and your team's effort. I just want to reiterate, if you just got on the internet or the TV to watch this, how incredibly important all of these guidelines are. I want to impress upon every single Mississippian how seriously we continue to take this. I know that this has been going on for months and months on end. And I know that people are tired of it. And I know that you want to get back to life as you knew it 3 months ago. What I'm suggesting to you is, by doing so, you are taking risk. You're not only taking risk that may have negative consequences for you, you're taking risks that may have negative consequences for those around you, some of whom may be more vulnerable than are you. So the people at least sitting at this table continue to take this very, very, very seriously. And I urge you, as my fellow Mississippians, continue to do so as well. Just to give you an idea, we have spent time today, we very well may have a tropical storm that hits the state of Mississippi sometime in the next 72 to 96 hours. We know that we have protests and in some very few instances, riots around this country, and we are continuing to prepare for those. We also know the Mississippi legislature is in session. We also know that there are other items that we're dealing with, reopening DMV, et cetera. But even with all of that, the vast majority of our time is still dedicated to making sure that we deal with COVID-19 and that we have a scenario in which every single Mississippian who needs quality care gets that care if, in fact, they can get better. I'm going to turn it over to Director Michelle, who's going to talk a little bit about the fact that Monday, just 3 days ago, was the beginning of hurricane season in America and in the Southeast, and what we're doing to deal with that. Director Michelle?
Thank you, Governor. Just start off today with a storm update. As many of you have been watching on the news over the course of the last few days, you noticed that we do have Tropical Storm Cristobal is out there churning waters in the lower southern part of the Gulf of Mexico. It is moving slowly. I guess the so what to that is that we're going to watch it closely. It is expected to make landfall sometime, as the governor said, either late Sunday or early Monday. That could change, of course. The probability or the forecast right now is for that storm to come ashore as a tropical storm, about 50, 70 mile-an-hour strength winds. And we, at worst case, we hope that it will not increase from there. What that's going to mean to us, though, at about 2 days out, beginning probably late Thursday or Friday, is we will start feeling the winds of that storm. We will start feeling there's going to be a lot of rain forecast for over the course of the weekend. So regardless of where that storm makes landfall, we can expect to have some wind gusts. We can certainly expect to have a lot of rain. So be prepared for some lower coastal flash flooding in areas that we typically see. But the bottom line, we're just going to continue to watch the storm, and we'll get a better update on that tomorrow with our Weather Service update. I did return from some good meetings with the 3 lower coastal county emergency management directors. As expected, the biggest discussion there was operating of shelters during this COVID environment. We've talked about that a number of times here, but I just want to reiterate to those that might be seeking shelter for refuge during the storms this year, they're going to look different during the COVID environment. You will be required, it will not be optional, you will be required to wear a mask if you go into a shelter. There will be masks available, there will be hand sanitizer available, but based on CDC's guidelines, there will be social distancing will be enforced to the extent possible. So as we have said before, if at all possible, you should have other options and other plans other than going to a shelter if you can avoid it. Your risk of exposure, of course, is always going to be increased when you're around people that you do not know, and unfortunately in shelters that will be the case. At the end of the day, shelters will be made available, and we will allow people to come into those shelters to ensure that we protect life and property during these storms. So we'll just continue to watch that, and we do have plans in place to make sure that those shelters will be open if they need it to be. PPE just update, just real quickly, not going to elaborate a lot there. We are continuing in the midst of, to the governor's point, With everything that's going on, we still continue to monitor the COVID situation very closely, and obviously one of the biggest pieces that we have at MEMA is the PPE push. We're pushing that out daily. One thing that I would like to talk about is the community mask program. When we first started pushing masks out, that was a mix of the washable cloth masks as well as the disposable masks. We did get a lot of, not necessarily complaints, but we got a lot of feedback about the type of masks that some people got. They were different masks, as was the case, but we had to get those masks out. We are going to make another push of community masks. Will go out tomorrow. They will be the washable cloth mask, and we'll push those out to the counties, and every county has got their own community mask program, so just get there. I do want to remind, though, remind everyone about the community mask. You need to start procuring your mask as you can. You can get these online with Amazon and buy you some cloth masks. At some point, our ability to continue to push masks out will dwindle. So it's very important that where you can, to those that can, acquire your mask. The masks that we're pushing out, that I want to make sure that we keep as many available for those that don't have the means to get masks on their own. But the bottom line is we'll continue to push that out. And Governor, that concludes my update for today, sir.
Thank you. Appreciate everyone being here today. Obviously, we've got a lot going on in Mississippi right now, and I'll open the floor to questions. Courtney Ann?
My first one for Commissioner, can you talk about kind of how you guys arrived at the setup that you have with the alphabetical situation and kind of how you determined the services that would be online versus in person?
Sure. Well, in looking at the overall goal, which is, and I'll emphasize, this is a reopening plan. This isn't a long-term fix for driver's license services. So realizing that we had a 3-month backlog of cases, or not cases, but services that people were going to be seeking, we knew that if we just opened up carte blanche, that we'd be overwhelmed with people the very first day. There's people in line every morning here in Jackson, and we haven't even opened up those services yet. And I watch them leave when they're told we're not doing that. So I knew that as soon as we did open, we would have an overflow of people. We floated different ideas amongst the staff, and ultimately the simplest method was the best, which was to divide it out in 4 different areas based upon the person's last name. And that is to minimize the people that are coming during the day so that we don't have everybody showing up on Monday, June 8th to get these products. So by dividing it out, we're hoping to, for lack of a better word, flatten the curve, or better saying, at DPS when it comes to driver's licenses. And so by doing this, and again, I want to emphasize, it's not a good idea for everybody whose last name starts with A through E to show up on Monday. You know, wait a week, maybe wait 2 weeks, even 3 weeks, and we can spread this out and get everybody taken care of in a timely fashion. So that was the general goal with that. And then, you know, I can tell you also when we looked at the issue with the driver's road test, that it's going to save time because it's going to keep that examiner in the building so that they can help facilitate the transactions. And most importantly, there was a concern about COVID in the cars. People are bringing their own cars. We don't know if they've been cleaned. We don't know if somebody's had COVID in there. We just didn't know, and we felt like that was the safest manner in which to deal with that. And you have one more question. What was that?
I think that addressed it, just kind of why those services that had been decided on.
That was it.
Commissioner, can you clarify though, the alphabetic order? Like you said, A through E, Monday, and then what are the other days?
All right, Monday, all names beginning, last names beginning with A through E will be on Monday.
Okay.
All names, last names F through L will be on Tuesday. Wednesday, which is walk-in Wednesday, will be open to anybody. Thursday, last names beginning with M through S. And Friday, last names beginning with T through Z. And one of the reasons why we put walk-in Wednesday as the open day is that's kind of when we traditionally saw our lowest traffic numbers anyway. We were afraid if we put it on a Friday or a Monday, again, it would tend to overwhelm the system. The middle of the week worked better. And let me say this, as far as which services we decided to offer, we've basically opened them all up except for those that can be done easily online. And if anybody has a trouble renewing online, we will have a number that they can call, and we will have on the website a link that they can hit to send questions, and we can help get them through that.
Again, If you are simply renewing your license, if you have a valid driver's license in the state of Mississippi right now, www.dps.ms.gov, click on driver's license or driver services on the very front of the website and go online and renew it. If you do that, you don't have to come in to any of the facilities that are open. And if the facilities that are open don't have the 80% of people who need simply to renew, then that frees up time. What that's going to do is that's going to, get your license renewed, and that's going to mean you don't have to go into the actual building itself. Not going to the building is going to accomplish two things. Number one, you're not going to get real mad because you're sitting there waiting for hours and hours on end. And number two, you're not going to catch the COVID if you stay at home or go to a public library to get online to www.dps.ms.gov. Now, we understand that there are going to be exceptions to this, just like there are exceptions to everything in the world. But the reality is, if the 80% of Mississippians who are sitting at home right now that need to simply renew their license will spend the next 4 or 5 days before this opens on Monday, and they go to www.dps.ms.gov, click on driver's license, you can get that renewed. It's going to be mailed to you, and boom, you don't have to deal with it again for another eight years. So, Emily?
I wanted to ask you about deployment of the National Guard in response to some of the protests and demonstrations that are going on. How is the National Guard deployed? Where are they being sent?
Yes, at the request of our federal partners, we, along with about 8 or 9 other states, have sent Mississippi National Guardsmen to the District of Columbia, and we have also sent assets to a couple of other states, or maybe one other state, to help ensure that the protesters are protected, those who are protesting peacefully, but then also provide support as needed in any way to make sure that those who are not peacefully protesting, those who are going across that line and rioting, are dealt with as well. And so the vast majority, I would say 99.9% of all Mississippians are in the District of Columbia that have been deployed. Now, we are looking at others. You know, one of the things that we know as Mississippians is that Mississippi has more National Guard troops per capita than any other state in the nation. That's because we are a very patriotic state, and we have fantastic people throughout our state of all walks of life who put on that uniform, and we appreciate their service. We do anticipate that we're going to have protests this weekend in our state in various places, and it so far appears clear to me that the organizers of those protests have every intention of them being peacefully done, and just as they were over this past weekend and as they've been done last week and earlier this week in our state, Mississippians do not want to tear down our state. They want to protest. They want to be clear. They want to be heard. They want a voice, but they do not want violence. And I appreciate my fellow Mississippians who are in that position, and we want to make sure that we provide an environment that allows them to peacefully protest, protects them, but also protects the lives and property of other Mississippians. Yes, Renee?
Jack from Turning Ledger has a question.
Hey, Governor. President Trump has called on governors to dominate the streets and said he would deploy the military to locations around the country where local officials are unable to control the unrest. Our defense secretary has said that he opposes invoking the Insurrection Act, which would permit the president to federalize the National Guard to respond to rioters. Fortunately, in Mississippi, I think we've seen almost entirely peaceful protesting so far. But my question for you is that would you support, or do you think it's appropriate to use the military to quell protests and unrest?
Thank you, Jack, for that question. I want to begin by reiterating something that you said, and that is the protesters in Mississippi over the last 10 days have been peaceful. They have, again, wanted to have their voice heard. They have not been seeking violence. And so what I would tell you is I do not anticipate it would be necessary in the state of Mississippi for the president to send federal troops to our state. As I mentioned earlier, we have a large percentage of Mississippians are participating in the National Guard. They will operate under the command of the governor should I choose to activate them. And should I choose to do so, they will be here in such a way to protect the protesters who are doing the right thing and to provide backup in the event that's necessary. But for instance, in our capital city, we have not only the Jackson Police Department, but Hines SO. We have backup from state police if necessary. But again, we have not seen and have no reason to believe at this time that any of our protests are going to be anything other than peaceful. There are a number of them scheduled for Saturday, and we are going to work with those organizers who have made it very clear. And by the way, the organizers have not only said that they want a peaceful protest, they've also been very clear they want a safe protest. And they've talked about having masks available and wearing masks. And that's one of the things that I really worry about as I watch some of these protests around the country with tens of thousands of people very, very near one another. Even if half of them have on masks, they're shouting, they're chanting. And while I certainly don't believe I'm in a position to tell anyone how they should express their anger, having dealt with Dr. Dobbs and his warnings over the last 3 months, it does worry me in many other parts of the country where we're seeing individuals that are, even those who are peacefully protesting, I'm afraid we're putting ourselves as a country in a spot where more and more spread could take place. And so in our state, we believe we have adequate resources. We can take care of ourselves, and we have every intention of doing that. Yes, ma'am.
Hunter Dawkins with the Gazebo Gazette has a question. We'll come back to Hunter. Dave Elliott with WLOX has a question.
Can you hear me? I'm having an issue here.
I can hear you now, Dave.
You can hear me? Okay, good. Dr. Dobbs expressed grave concern over community spread, large gatherings, people not following guidelines. Of course, businesses and public areas have reopened. You say you don't want to issue more executive orders, but if things trend in the wrong direction, will you? And how far are you willing to go if you don't like what you're seeing regarding the numbers?
Well, I think the best way for me to answer that, Dave, is that I've already issued quite a few executive orders that I didn't want to issue. I did not want to shut down any business in our state. But I am prepared to do whatever I believe is necessary under the allowances in state statute to protect my fellow Mississippians. It is incredibly important that our people adhere to the guidelines. It is incredibly important that our local jurisdictions pay attention to the executive orders and adhere to them. Everything from social distancing to the guidelines with the number of people, etc. That is incredibly important, because if we don't, if we see strains on our healthcare system, I'm going to be left with very little choice but to backtrack to a place that we were at some point in the past, and I have no desire to do that. Yes, ma'am.
We got word that as it relates to the death of George Floyd, that the officer who is been seen on camera, his charges have been upgraded, and then the officers that were with him have been charged. Do you have any thoughts on that?
Well, and the question for those of you who may not have been able to hear was with respect to the fact that earlier today, one of the prosecutors upgraded the charge on the individual who had already been arrested, and provided additional charges for 3 others who were involved in the incident. What I would tell you is, from what I have seen from the tapes, that's certainly understandable why the prosecutor has done that. I believe that everyone deserves their day in court, and I wish that George Floyd would have gotten his day in court, because we're all entitled to that. Unfortunately, it appears that these individuals took matters into their own hands. They went far beyond where they should have gone, and it appears, at least at this point in this case, the prosecutors are doing what they should be doing, and that is they're actually looking at charges. I think that those in the federal government, again, whether it's the Department of Justice or otherwise, should be looking at any federal statutes that these individuals had violated as well. One of the things that we have to do is we have to be willing to admit when mistakes are made, and we have to be willing to prosecute those who who cross that line. If we want to prosecute those who are rioting that cross that line beyond peaceful protest, we also have to prosecute those who have crossed the line, as it appears all 4 of these individuals in the George Floyd case have done.
Going back to Hunter at the gazebo, is that? See if we can get Hunter?
Yes, ma'am. Thank you, Renee. Thank you, Governor. I appreciate it. The question I have for you, and this could also be for Commissioner Tindall, what steps do needs to happen for young adults who are trying to get their licenses, or not only young adults, but other individuals trying to get their licenses that have not or are supposed to go through normal tests, but they don't have the access to do so now?
Thank you, Hunter. As I mentioned, by waiving the road test in lieu of the affidavit, and particularly for those that are under the age of 18, the affidavit will certify that the parent or guardian has witnessed these individuals driving, these minors driving their vehicle with a learner's permit, and that they've done so for at least 50 hours, and that they're certifying their driving capabilities. And these affidavits and waivers will be available at the driver's license station as well as online, so they can be completed before you get there, or if you don't have it, you can do it when you get there. And so that's kind of how we're going to deal with that part of it. If you're over the age of 18, you're not going to have to do that. This is just for those under the age of 18 who have been using a learner's permit. So if you're coming in from out of state or you're getting a new license issue, you're not going to have to do a driver's test.
Yes, sir.
Commissioner, how
Eric Walker with WJSU has a question.
Eric?
Good evening. Hello.
Hey, Eric, this is, go ahead.
Good afternoon, everyone. Okay, I got you. I wanted to ask a couple of questions. One for the governor, and the other for Dr. First, Governor, I'm sure you've heard about some just comments coming out of Madison County prosecutor there.
Eric, I'm afraid that we do not have I think it's fair to say that we don't have a very good connection, so maybe you could try to reconnect and send it in.
His court, across relates to Governor, and for Dr. Today, specifically saying that sending off our visa.
Okay. Sorry about that. Tate Reeves with the Vicksburg Post has a question. See if we can get
Great, thanks.
Yeah.
Okay, one question for Commissioner Tindall and then another for Dr. Dobbs. Commissioner Tindall, locally, our DMV office has been, had a problem with staffing that has led to, in the middle of the day shutdowns. I think it's just 2 personnel. As this pent up need at offices, especially here in Vicksburg, do you see a staffing issue that can be resolved to accommodate all these demands? And secondly, for Dr. Dobbs, I asked the other day about the outbreak in Claiborne County that you said was helped double the numbers there. We had 3 deaths there today. Could you give us more details on that particular outbreak?
In regards to the staffing issues, first I would say that, obviously, as I mentioned earlier, this is a reopening plan. This isn't a permanent fix to all the problems at the Department of, or the Bureau of Driver's License Services. And in particularly when it comes to the number of stations we have across the state, I believe there's 31. A number of those only have 2 individuals working in there. And going forward, that's a problem we seek to address, and doing so probably by some form of consolidation and having larger offices that can better deal with more customers. So yes, there could be some issues, but again, we're hoping that by dividing it out into a number of days, we minimize the traffic through there so that we can facilitate these transactions in a timely manner. And so, I'm looking forward to working on that particular issue as we go forward.
And then on the Claiborne County issue, and I don't have it in front of me, but from when we looked at it yesterday, it looked like it was an outbreak, and I do believe the outbreak was in a long-term care setting, and certainly we know the devastating impact that can have. I'm not sure about those specific death numbers in comparison to the total, but as I mentioned, we will be getting additional information out for each county and each long-term care setting, and that should be available to you hopefully by this afternoon or this evening.
Thank you, Dr. Dobbs. Yes, ma'am.
Dr. Dobbs, speaking of long-term care facilities, do you have any details that you can share regarding that report that's supposed to come out this evening?
Well, certainly we'll have the names of the active outbreaks. And from our review, given the number of patients and the number of cases, that the risk to individual privacy was minimal. So appreciate the Attorney General's given it the AG's office giving it that close look. We will try to give some information on number of cases, number of deaths, and that sort of thing. We're looking at all the different and varied requests, trying to see what we can collate into a common sort of daily report so that we can get you guys the information you're interested in.
Since there have been so many cases in these facilities, are there any special measures that are now standards in terms of cleaning and visiting?
Yeah, there are very clear guidelines. We're still restricting visitation to nursing homes and other long-term care settings because of the risk of bringing it in. Obviously, we just tested every single nursing home in the state and trying to identify who might be at risk and who might be contagious and putting those folks on isolation and that sort of thing. We're looking at a long-term strategy as far as regular testing of employees and outbreak testing too. So, and obviously there's infection control practices. There was communications from CMS about their expectations for doing more infection control. That's something we have been doing, but we're going to ramp it up. There are certain sort of infection control assessments and education sort of tools that CDC has put together for us that we're going to try to implement universally. Although we have been doing guidelines for everyone, we're going to be more hands-on as we go forward.
Let me just add to that, because we had a coronavirus task force meeting earlier today. We learned a lot. It was exactly 3 weeks ago today that on our coronavirus task force meeting, Dr. Deborah Birx suggested strongly to every state that we test all residents in nursing homes and all staff. As I told you, that's 27,500 in the state of Mississippi. That was 3 weeks ago today. On Thursday, I brought our team together, Dr. Dobbs and his team, and kindly suggested that we try to do that. And suffice it to say, there was a lot of concern that we'd be able to get that done in such a short period of time. But to their credit, they said, we will see what we can do. On Friday, we tested the first individual, and then this past Friday, 14 days later, at the just exactly as the coronavirus task force had asked, within 14 days we had tested everyone. Now we're in the process now of aggregating that data so that we can see exactly how many people had it, what were the symptoms, et cetera. All of those things are being done. I mean, look, when you take on a task of that magnitude, it takes a little bit of time to aggregate the data, and so that's one of the things that that as there are so many requests for data now from the department, and they're doing everything they can to get that information out as soon as possible. But we've got to prioritize, and they've got to prioritize data management for those of us who are making decisions, right? And so they're working very diligently right now to get us the report on exactly what that looks like, how many positive cases came out of those 27,000 plus tests, et cetera. But I tell you all of that to say, and brag on Dr. Dobbs and his team. I asked them to do it within 14 days, as was asked by Dr. Burks. And even though they didn't know that they necessarily could, they went to work. They employed the public health teams at the Department of Health, the Mississippi National Guard, our MEMA representatives, and they got it done. And what we learned earlier today is less than half of all states, even today on Wednesday, 3 weeks later, have successfully accomplished that. Again, that speaks to one of the things that we've been talking about since the beginning. We are committed to doing tests. We are over 65,000 tests per million residents and headed very quickly towards 70,000 tests per 1 million residents, which again puts us in that small group of people that hasn't tested as much as, say, New York and New Jersey or Louisiana that got significant federal resources to test. Much like I said earlier, we'd be able to take care of ourselves over the upcoming weekend. We've been able to take care of ourselves on testing as well, and that's a credit to everyone involved in the process. Yes, ma'am.
Did I hear you mention when you were talking about community spread and those initial remarks, parades, or that was one of them? We're seeing a lot of these like drive-through birthday parties and graduations, but sometimes in the videos we see people still hugging through the. Can you elaborate since that was mentioned?
Yeah, I'm going to let Dr. Dobbs tell the story because he told it to me earlier today. So,
yeah, so things start off sometimes with the best of intentions and they deteriorate rapidly, right? So if you have a parade and the people in the cars are separated from one another, that's fine. It's the people who are not in the cars, right? And so we've seen parade situations where, like graduation type things, where they're driving through, but then crowds are all clumping together on the side of the road. And, and then the touching piece, and that's one thing that's so very tough about funerals and about weddings or even a graduation ceremony, is because people let their guard down because of the emotions, and the virus doesn't care. And it's just really not okay that we let these events get the better of us. So we need to really, really be cautious.
So let me contrast it for you. So early on in the coronavirus, there was individuals, maybe an 8 or 9 year old that had a birthday, and they were terribly upset that they were having a birthday pass and they couldn't do a birthday party. And believe it or not, there were some of these 8 or 9 year olds that didn't care that the governor wished them a happy birthday on statewide TV. And so they planned birthday parties in which the 8 or 9 year old came outside, mom and dad came outside, and then 10 or 12 or 15 cars with different 8 or 9 year olds in them drove by, waved, honked their horn. That's perfectly safe. Now contrast that with the potential of a parade in a small town where there were 75 individuals that graduated from high school, and we're going to have a parade where we celebrate those 75 graduates, and those 75 graduates, with the best of intentions, get in their vehicles, they ride down Main Street, all is good, they're protected, and then 500 of their residents, their mamas and their daddies and their grandmamas and their granddaddies, all get on the street to wave at them, and then as they're on the street to wave at them, they cluster, and they get closer together. And when that happens, you just had an event with the absolute best of intentions that just didn't turn out the way it needed to. And so we've got to be smart. We've got to think. I mean, I even myself had a meeting with a group earlier today outside the office, and I have to tell myself I'm not going to shake hands with these individuals. And because the natural thing, of course, because I mean, I'm been in politics for a little while, and I've shaken, you know, in 2000, I don't know what I would have done in 2019. I must have shaken 50,000 hands a month. But handshaking is not really in vogue right now. And so we've got to be smart about it. And we've got to constantly be thinking about the coronavirus. We have a natural tendency to say, this is over and behind us. I'm getting it out of my head. And that's just the wrong approach right now. Yes, ma'am.
Erica Hensley with Mississippi Today has a question. Erica?
Yeah, thanks, Renee. I've got a question for Dr. Dobbs, following up on long-term care, and this might be addressed in the forthcoming report, but I'm wondering if what you've seen so far in the targeted universal testing has suggested that healthcare workers were contributing significantly to the recent cases, because the residents have only shown about 10% of new cases over the week. So I'm wondering if asymptomatic healthcare workers might have been driving some of that.
Yeah, absolutely. It looks like that the driving force for transmission within long-term care is going to be the employees. You know, and again, this gets back to this community piece, right? It's not that the healthcare people are sending out to the community. It's people are catching the community. Mostly they're going to be pre-symptomatic or asymptomatic. I mean, our sense is that people are sick or not coming to work, although that, you know, that certainly can happen, and then unknowingly will infect folks. So that's probably going to be the main reason. There's probably a small contribution for residents who come in and out, who might have to have some sort of medical visit or something, because that does happen quite frequently. Although that's certainly a great location for telehealth if it can be done, right, to prevent that sort of thing. But it just speaks to a couple things. But you know, testing certainly is an important piece, but it's not magic, because if I test negative today, it doesn't mean I'm not going to be positive tomorrow. I could be incubating. But infection control, and if we pretend like everybody that we're around has coronavirus, it doesn't mean we have to be wearing a spacesuit all the time. But if we maintain some distance, if we don't get up around the break table and chat, if we wear a mask around other folks, and if we just every universal precautions for taking care of our clients in the nursing home. We've seen places that maybe had one employee and they had really great protocols for infection prevention, and that was it, and it just stopped. And that's the kind of thinking that's going to have to go forward. Can't test our way out of it, although it's an important tool, but combined with proper infection prevention, we can do a good job.
Jack from Clear and Ledger has another question.
Yeah, Dr. Dobbs, earlier you mentioned that there are some regions in the state that are seeing their ICU beds at capacity. I'm sorry if this is something you've kind of addressed previously, but could you just go over what those regions are and just maybe go a little more detail on that?
Yeah, so mostly it's been kind of the Jackson area, Jackson, the West Central Mississippi, and then in sort of like the Pine Belt area. But even on the coast where they're not having as many COVID patients, their ICU capacity is very low because they're full of non-coronavirus patients. And this is not something that's that abnormal to have it here and there happen from time to time, but it's happening a lot at the same time. Part of that is because we suspect there may be a backlog in elective procedures. That's possible. We don't have data on that yet. But clearly, the amount of coronavirus patients who are in the system are enough to give us if we're running at like 10% margins and 10% of your patients are coronavirus patients, well, then you're full. That's all it takes. And so it's going to take multiple concepts to kind of make sure we have the adequate healthcare capacity to meet our emergency needs.
And one of the things that I'll just point out that as we've talked through these items for months now, remember that if there's an elective surgery and for whatever reason the patient has to go into an ICU bed, well, they may stay there a day or two or maybe three, and some are much worse. But most COVID-19 patients that go into ICU rooms don't get out in 12 hours or 24 hours. They can be there for weeks on end, and we don't have specific data that could give you an average period. But if you're thinking 15 to 20 days, you're much more likely to be accurate for the average COVID patient than if you're thinking 15 to 20 hours. And so when you take, say, what we have right now, which is 141 COVID patients in ICU beds, and you take the fact that that 141 would likely be there for 2 to 3 weeks, well, then now you start seeing why your capacity overall can be limited. And so that is the reason that in our order we mandated that every hospital maintain at least 25% of their capacity for COVID patients, and that's critically important. And what they've got to do, and what is they're going to have to manage their caseload of elective surgeries and other things so as to make sure that they adhere to what is in effect a state law. Yes, ma'am.
Desiree Frazier from MPB has a question. Having some issues. So Sarah Ulmer with Y'all Politics has a question. Sarah?
Hey, Dr. Dobbs, this question is for you. On our COVID reporting numbers, are we getting numbers also from individuals that live on our reservations? Are those part of what's getting reported as well?
Yeah, yes, those come from Choctaw Nation and other Native Americans. Yes, ma'am.
Hunter with the Gazebo Gazette has another question. Hunter?
Thank you, Renee. Thank you, Governor Reeves. This question is for Director Michelle. As far as it goes with the, when does the preparation begin at the shelters, to your best of your knowledge, in preparation for the storm?
Thanks, Hunter. I appreciate that question. Actually, it begins now. We've been talking about this for the last 2 to 3 weeks. So preparations include in implementing the CDC guidance that we've got. With the guidance that we have this year, it's the square footage requirements are going to require more shelters be available this year. And then, so that's going to mean more volunteers. So it's been a resourcing issue, which has been the majority of the planning. And then the other issue is just making sure that we've got the appropriate PPE available. But that planning and those discussions have been ongoing. It started earlier this year because of the COVID environment. So again, that's one of the things that we talked about this week or yesterday when I was talking with the coastal counties.
Yes, ma'am.
Governor, so Madison prosecutor Pammy Hancock is receiving some national attention for a comment she made on social media stating that she hopes the deadly strain of COVID-19 spreads and riots. Just your thoughts on that? Do you denounce that statement, and do you believe that she should step down?
Well, I didn't see that she had said that, but clearly I don't want the spread of COVID-19 to occur in any group of individuals. Having dealt with COVID-19 for a large number of days and weeks and months, and quite frankly, hours and hours and hours of every day since mid-February has been dedicated to COVID-19. I've seen the effects that it can have on individuals who receive it, and I do not wish that particular plight on any American. It doesn't mean that I condone riots. I certainly support peaceful protest, and I hope, and I've said this repeatedly to those who would listen, if you want to peacefully protest in Mississippi, we're going to do everything we can to protect your right to do so. And I certainly don't want to tell you how to express your anger, but I do want to strongly encourage you, if you peacefully protest in Mississippi, to do so and to wear a mask and to socially distance, because what anyone thinks about the virus, whether you like it or not, what Dr. Dobbs said earlier is the virus doesn't care. They don't care if you're gathering in a group of 10,000 to demonstrate on something that deserves your voice being heard. It can spread anyway. And so in large groups that are gathered close together, that are verbally expressing their opinion either through chanting or singing in the church choir, is a very good opportunity for the virus to be spread. And so I hope that everyone in our state and quite frankly everyone around the country will adhere to the guidelines that have been in place. And then what I will tell you is, certainly in our state, I watched a large number of people gather outside the governor's mansion on Sunday afternoon, and my recollection is, if not, y'all got it on TV, I didn't actually see the reports, but my sense was 95% or so had on masks, maybe even a higher percentage than that, and that's what I appreciated, is that they wanted to have their voice heard They weren't focused on any violence, and they were actually trying to protect one another. And some of the flyers that I've seen that have gone out for this upcoming weekend, they've said this isn't for violence, this is for peace, and also bring a mask. And so that's what I'm looking for. So.
Circle back to what I asked earlier about the deployment of the National Guard. How many troops has Mississippi sent to Washington, D.C.? And also, you mentioned that Mississippi has sent equipment to other states. What kind of equipment and where?
So I'll have to get that information for you, Emily. I don't have the numbers memorized. I know that the Guard sent out a press release earlier today, I think around 10 o'clock, which should have that information on it. But again, I don't have that particular document in front of me, but we will get it to you or we'll get the Guard to get it to you. Yes, ma'am.
Jack from Clearing Ledger has another question.
Can you hear me?
I can hear you, Jack.
Yeah, I had a reader that just wanted to know if there's been any update on how MDOC is handling visitation or any kind of changes planned. And then also, I was then wondering if there's been any update on just the number of inmates and MDOC employees that have tested positive for coronavirus.
Thank you, Jack, for that question. To my knowledge, there has not been any significant changes on the way in which we are dealing with COVID within our prisons. We do have a new commissioner that is reviewing that, working with his team there, and I expect that should he decide that changes need to be made, he'll either make those recommendations to us or he will enact them. In terms of testing, the update as of today, Wednesday, June the 3rd, we have tested 77 inmates. 32 of them have tested positive. 42 of them have tested negative, and we have 3 that are pending. With respect to MDOC staff, we have tested 126 staff members at the Department of Corrections. 18 have turned up positive, and 98 of those 126 tests have turned up negative, which leads approximately 10 tests outstanding that are still pending either a positive or negative result. It appears that is the final question today. Thank you all for being here. Emily will get you that information, either the Guard or one of my team will. Again, I can't reiterate enough how important it is that we stay diligent, that we stay safe. So thank you to my fellow Mississippians for what you're doing, and God bless.